So coming to the introduction of EVOKE-02 study, PD-1 inhibitor-based regimen have been established as a standard of care first-line treatment of metastatic NSCLC. And novel combination therapy are needed to further improve the outcome. Sacituzumab govitecan is a TROP2-directed antibody-drug conjugate approved in the United States for the treatment of subset of breast cancer and received the accelerated approval for second-line metastatic urothelial carcinoma. So EVOKE-02 study was conducted in treatment-naive stage 4 NSCLC with measurable disease and without known actionable genomic alteration. Patients with a TPS of 50% or greater were enrolled in cohort A, and those with TPS less than 50% were enrolled in cohort B. Both cohort A and B were treated with a 10 milligram per kg of sacituzumab govitecan on day 1 and day 8 every 21 days until progressive disease or unacceptable toxicity. Pembrolizumab was given at a standard dose of up to 35 cycles. The primary endpoint of the study was the objective response rate. Median follow-up for cohort A and B was 5 months and 5.8 months respectively. Regarding patient characteristics, these patients represent advanced NSCLC patient population in general. The majority of patients were male and had equal PS1, and 60% of patients had non-squamous histology. More than half of patients had PD-L1 less than 1% in cohort B. Regarding the treatment duration, median duration of treatment of sacituzumab was 4.1 months in both cohort, and that of pembrolizumab was 3.6 months and 3.8 months respectively. Median number of cycles received for sacituzumab and pembrolizumab was 6 in both cohort. Given that majority of patients are still on the treatment, these numbers may change with a longer follow-up. 63% of patients in cohort A continues sacituzumab and pembrolizumab treatment, and about 40% of patients in cohort B continue these treatment. Across both cohorts, the most common reason for this continuation of sacituzumab was progressive disease. Coming to the efficacy by investigator assessment, the objective response rate was 69% in cohort A, while it was 44% in cohort B. Only 10% and 6% of patients in cohort A and B had progressive disease as best overall response, suggesting that the addition of sacituzumab may have contributed to overcoming primary resistance to pembrolizumab. Sacituzumab and pembrolizumab combination induced a significant tumor shrinkage in the vast majority of patients, regardless of PD-L1 expression level. If we look at the spider plot showing the percent change from baseline over time, tumor responses were rapid, often deep and durable, lasting longer than 6 months in many patients, suggesting good tolerability of combination treatment in both cohorts. Coming to the safety, grade 3 or worse treatment emergent adverse events and AEs related to study treatment occurred in 70% and 38% respectively. TAEs leading to treatment discontinuation of sacituzumab and pembrolizumab were 14% and 13% respectively. TAEs leading to death occurred in 4 patients. However, only 1 case of sepsis was deemed related to the study treatment. Coming to the any grade TEAEs reported in more than 15% of patients, All these adverse events were predominantly grade 1 or 2, except for grade 3 neutropenia. The most common any grade TEAEs were diarrhea, anemia, and athenia. Regarding the immune-mediated TEAEs, these immune-mediated TEAEs were consistent with known safety profile of pembrolizumab. Grade 3 pneumonitis was the highest grade observed to date that occurred in only 2 patients. So in conclusion, the EVOKE-02 study, this novel combination of Sacituzumab govitecan plus Pembrolizumab in treatment-naive advanced NSCLC patient population demonstrated encouraging anti-tumor response regardless of PD-L1 expression level. Safety profile was generally well tolerated, and immune-mediated treatment emergent adverse events were consistent with known safety profile of pembrolizumab. Based on these results, randomized phase 3 study is conducted, that is EVOKE-03 study, that is evaluating pembrolizumab sacituzumab combination versus pembrolizumab alone in PD-L1 50% or greater advanced stage NSCLC patient population.